Let's get started. Okay. Thank you everyone for joining us today. For those who don't know me, I am Monica Grippo. I am the founder of Rhea. I built Rhea as a community to support people going through fertility challenges and pregnancy loss. And I'm really excited to have a very important conversation today with Kim Schamroth. She is the head of patient empowerment at Grain Fertility. She has been working in the fertility space for over 7 years now. And what we want to really focus on today is empowering everyone to make the most out of their fertility journey when they're working with doctors, nurses, clinics. And what I mean by that is making sure that you're asking the right questions and advocating for yourself along the way. When I started my fertility journey, when I actually decided to move forward with IVF, I went into it kicking and screaming. I did not want to, I don't think anyone goes into family building thinking that they're going to have to do IVF. Um, and I was completely overwhelmed by the process. I really struggled through the entire thing, and I'm still honestly struggling through my experience with my fertility clinic, even though I successfully had a great round and was able to have my daughter because of it. I still find the experience really challenging. So I hope with this conversation today with Kim that you all walk away feeling a little bit more empowered and have the right tools to make this journey a little bit easier. So with that, I wanted to move on to the next slide. So I already mentioned Kim has been working this space in the hospital side and clinic side for more than 7 years. She is the head of patient empowerment at Grain Fertility, and the platform is really intended to provide personal coaching and organizational services for people going through a fertility journey. And we're going to learn more about Grain Fertility towards the end of today's discussion. But with that, I wanted to hand it over to Kim. Kim, we'd love to have you share a little bit about your journey and your role with Grain Fertility.
Thank you. Thank you, Monica. It's really, truly an honor to be here today. And I'm really looking forward to supporting the community by addressing all questions and concerns and hopefully making everyone's fertility journey even slightly easier. And so, like Monica had shared, I've been a fertility nurse now for 7 years, and this is absolutely my greatest passion. I am so honored to be working in a career that has so much meaning to it, and especially working with people who are navigating a very vulnerable time in their lives. I've worked in the clinical side for 5 years, working with thousands of people navigating their fertility journey, whether it was trying to conceive for a number of years, whether it was people who are going through fertility for because of recurrent pregnancy loss, because of genetic difficulties, members of the LGBTQ community. And I have never once heard someone say the fertility journey was just a walk in the park and easy. Not one fertility journey is the same as the other. And from the thousands of fertility journeys I've seen, everyone has walked away saying, wow, this is difficult, and how can we make it better? And I'm really honored to be working at Grain Fertility, where we are striving to make that a more positive experience for people nationwide that are really looking to gain that support and to have a better understanding of their fertility so they feel less alone. And I find it to be really wonderful, a community such as Raya, where I know how isolating the path to parenthood could feel sometimes, and knowing that you're not alone, that there are other people who are navigating this as well, even if your two journeys are not the same.
So I wanted to just level set a little bit and talk about why we're here today. So, in a nutshell, we want everyone to walk away feeling more empowered to advocate for your care and make informed decisions. So today is not about providing medical advice or necessarily addressing anyone's personal fertility journey. As Kim said, everyone's situation is different. And while it is helpful to hear from others, we just want to make sure that it's clear that today is really about giving you the tools and questions to ask as you're working with your team, whether that is still with your OB even, or have now started working or thinking about starting working with a fertility clinic. A lot of the questions here today are kind of a combination of things that RAIA members submitted that they wanted to hear more about. And then also my own journey and things that I felt would be helpful to know going into it. And of course, Kim's experience as well. So I wanted to start with kind of at the front end, right? Like before you're starting fertility treatments and you haven't necessarily even met with a fertility clinic or just at the very beginning, we wanted to really lay out what are some of the key questions and discussion topics that you should be just taking the time to sit with yourself and ask. And also have discussions with your partner so that you really feel like you're on the same page going into this because it is it can be a very challenging time on an individual, but let alone your partnership and your relationship. So Kim, I would love for you to just walk us through some of the key questions of like, what should you be discussing and talking about going into a fertility in before fertility treatments?
Absolutely. And Monica, I would say that with the first question of how do we rank our priorities, it's a fantastic question to be asking before you get to the fertility clinic because so often people go in either Googling all of their questions or they are entering their questions into AI. They may fall down a rabbit hole of a Reddit group chat and you could get really lost in terms of what are the priorities I need to be looking for. And I think the best thing that this is what I would recommend to whether it was my loved ones, my partner, and I, to any patients going through the fertility journey is sit with either yourself or if you have a partner and just map out what that looks like for you in terms of okay, what are our main goals? What are we hoping this timeline will look like? And let's discuss with our fertility doctor what is the expected timeline? What is the goal and what is the actual reality of what it could look like? And setting up what your expectations are if you have a budget in mind. There are a lot of surprise bills, as you mentioned here, what the cost could be. A lot of surprise bills come into place. I think the importance is one, like a patient and their partner to be having full transparency of what all their different options could look like. So I think mapping out, like I envision having like a whiteboard where you just are writing everything out or brainstorming and looking at how we could look for, are we optimizing success? Is that our main priority? Is it getting this done as fast as possible? Is that our priority? Are we going to be more cost conscious or do we want to spend extra on X, Y, and Z? Not everyone may have the means to do so. When it comes to convenience, are we going to go to a clinic that's really close by? Maybe, I lived in Manhattan, you had a fertility clinic, like you have like a coffee shop every few blocks, but there are states across the United States where you may have to drive hours to get to your fertility clinic. Where are you going to go for your treatment? So I think before you get into that initial consultation that you have with your doctor or even finding a doctor, it's so important to map out these different questions in order to help you find the right place for you in order to begin.
Thanks for that. Yeah, I can totally relate like going into this without having some of these questions answered. I think the one thing I knew is that it really wasn't about speed for me. It was more about like preserving my like mental health and sanity and doing as little medication as possible too, because I've had bad reactions in the past from things like birth control and things. So that was my one driver. And I was very clear with that with my husband. And so I think that alone kind of helped steered us that was kind of my North Star is that I wanted as little medication as possible if I could avoid certain things. And then everything else was kind of secondary. Whereas I know some people are like, on a time, they're like, I have been trying, like, we're ready to go. Like, let's do this and let's get on kind of the most aggressive path to having a baby as fast as possible. So I do think that that is super helpful to get aligned. Um, I did want to talk a little bit more about the investment and asking like for help, right? Like, so sometimes insurance covers treatments, but then it's like there's a cap on them, right? So, what are some of the questions I think that you can ask, kind of like going down the road, like linearly, like first explore your insurance, right? Figure exactly out what's covered there and where do you go after that? Can you speak a little bit more to that aspect?
For sure. I also think it is very brave when people are able to even take that step to talk about something so personal as your own fertility journey with your HR department. It seems like a little bit eerie at first of like, wait, this is my own private life. And now I'm turning in such a vulnerable state to human resources to find out if there's coverage. But the reality is that it's very costly fertility treatments, and at this time, it's not covered for everyone. So I think if you're able to turn to your human resources department and reach out to them to find out what is covered, what is not, is a really big step that you could be doing for yourself and for your partner in order to see what options are available and finding out how your employer could help you, what benefits they have. It may be benefits in terms of medication coverage. There are some insurance companies that may cover a number of cycles that you may need to go through before IVF. You may need to go through other forms of fertility treatments that aren't IVF, but something called IUI, which is intrauterine insemination. They may require proof that you have been actively trying for X amount of time. And this is where I think insurance companies and could get a little bit personal into your own medical details, which could also be a bit uncomfortable. But I think the number one thing is speaking up for yourself and advocating for yourself to find out what that process looks like will yield you the best answers that you could possibly get. Is that like in terms of
Yeah,
time?
yeah, totally. Um, and I can also really relate to how this conversation can be really vulnerable, especially with your employer. I literally sat in my boss, who was the CEO of my company, like in tears and rage because our insurance covered zero fertility treatments and the company had no supplemental support. And I actually went to the Resolve website and found some great tools. For those who you don't know, Resolve is the biggest advocacy organization for IVF in the country. And they had some great materials in there of like, here's an email template, here's how you can advocate for yourself. So those tools are definitely out there, and we can share some of those. But I think it took a lot of courage and it was really tough. And at the end, I did not get any support from my employer, but that's not the point. I think the point is like you have to ask, right? Because, and even though it takes a lot of courage, like it's worth it. And then it also, I think, opens up the conversation. So maybe they will be a little bit more understanding, knowing what you're going through, that it's, a financial commitment and also a physical and an emotional journey that you're about to go on. Um, and this last piece in terms of like what support do you need and what are you sharing with others? I just wanted to share something that someone in the Rhea community posted about, and it was really the struggle around asking family and friends for support while also really kind of dreading them checking in of like, how are things going? Like, what's the latest? What cycle are you on? And, the one piece of advice I would say here is just like have the conversation with your partner and be on the same page of like who you want to share with, what you want to share, and then also set a pretty clear boundary if you can. So I decided that for our next transfer, if and when that happens, that we are going to sit down and talk about who we want to share it with, and then also ask them not to follow up with us and say, we really are so grateful to have you in our corner, but in order for us to kind of lower our stress and feel really grounded, we'll be sharing updates along the way. And we, kindly ask that you don't follow up with us. And I know that could be really hard to say, but if you can at least get on the same page with your partner going into it, it will feel a lot less kind of like, who are we talking to about, and stress people checking in. So that's one thing I would say on that.
If
Um,
I could add, Monica, there's
yeah, go for it.
something. Oh, no, I could very much still relate to it. As someone who, and I'm just going to share this with the community here, is that I experienced a pregnancy loss this past year, earlier in the fall. And it was a really big challenge. I felt incredibly alone at first. And simultaneously, my two sister-in-laws announced that they are expecting just weeks after. And it was very challenging because with my husband's family, no one, like, they acknowledged the first day about my loss, but then it was like a ghost town. And that was really hard, feeling like, wait, does no one think about me? Why is no one checking in? And then I think of the opposite, where there are some people that are texting, that could be texting you every few weeks, like, hey, just making sure you're okay. And it's like, I was okay until I got that text message randomly out of the blue. And so I think I completely agree with you about finding common ground with your partner about, okay, this is how we want to go about dealing with this, and dealing with navigating trying to conceive again, and navigating a past pregnancy loss, and having that open communication with you and your partner, and then with everyone else, is just so critical. And my whole thing as the head of patient empowerment, my number one thing to empower all patients, all members of Grain Fertility, anyone navigating their own pregnancy journey, is advocating for yourself and empowering for yourself. Because if you don't share what you're thinking, no one's going to read your mind and know what you're thinking. So transparency is key, and communication is key. And I completely agree with you. Of
Thank you. Thanks so much for sharing that.
course.
And speaking of advocating for yourself, I mean, here is really, once you're getting ready to start fertility treatments, and before you really get into the thick of it, can you walk us through some of the key questions that you should be thinking about asking the clinic or doctor that you'll be working with?
For sure. So often when I see people come to a fertility doctor for this the first time, it's typically after quite some time that they've been trying to conceive. And infertility is defined as anyone who's been trying to conceive with unprotected intercourse. If they're 35 years and younger, if it's been over a year, if it's 35 years and older, if it's been 6 months. And often people are a bit confused. They know, okay, it doesn't always happen on the first try. We're always taught in high school and college, how to avoid pregnancy. And then all of a sudden, once people want to get pregnant, it seems much more frustrating and difficult than society ever made it out to be. And people often don't know where to start. And I find most people, before they even go to their fertility doctor, they'll go to their primary care doctor, they'll go to their OBGYN, and may get an answer here, an answer there. They may not get a definitive diagnosis. And that's why it's really important to set up a consultation with what is called a reproductive endocrinologist and infertility specialist. We call them REIs for short because that is a mouthful. But these are fertility physicians who've done their 4 years of OBGYN residency, followed by 3 years of their infertility fellowship. And often what they do, I've sat in on countless initial consults with REIs when I was at CCRM, is they will walk a patient through, tell me about your past medical history, tell me about any family medical history that I need to know. And my recommendation is to include everything that you know. Even try, if you can, try to do some homework beforehand. Ask your mom, ask your aunt, ask a sister. Feel comfortable. I mean, it could be a little bit uncomfortable, especially if you're not willing to talk about your own fertility journey, which I completely understand. But any information that you could find out could be helpful for your doctor to figure out what the possible underlying cause can be. And sharing as much as possible will only give your doctor more to be working with. And so I would say is that your doctor will have that conversation with you. they will do a number of tests to work up what could be the possible cause. For men, a standard test would be a semen analysis and a set of blood tests to be looking at a number of different hormonal levels. For women, it's often a blood test as well, looking at your fertility hormones, plus an ultrasound looking at your ovaries and your uterus. But that doesn't give us the whole picture. Sometimes it's a lot more complex than just what we see on that initial screening. And so if your doctor comes back and says, yeah, everything's fine, I think it's important to speak up, be like, okay, well, what else could it be? What are other reasons why it's taking so long? And it's important to know because it could be multiple factors. Women tend to blame themselves for struggling to get pregnant. We hold this burden and this weight on our shoulders that we are meant to, you know, carry children and just bring children easily into this world. But the reality is that infertility is nobody's fault. It doesn't only fall on one person. It's 30% male factor, 30% female factor, 30% both. Often it's very common to see about 1/3 of people going through infertility. It's because of both partners in a heterosexual relationship. And then also there's what's called unexplained infertility. There are 10% of people who are going through their infertility journey who just never receive a diagnosis. That is a hard thing to swallow. I can understand like a hard pill to swallow. I know a number of people who have received this diagnosis and it just feels like there's nothing to be working with. But it's important to continue having that open conversation with your doctor about addressing what is the cause and what we could do moving forward.
Thank you. I think that's a really important place to start is just don't be afraid to kind of dig deeper and um things change. Our state of being changes, our mental state, our health. And so just want to use my story as an example of like, even though, I was able to successfully get pregnant and have my daughter through our first IVF round, I then had a loss and then had further testing and discovered things that I wouldn't have if I hadn't really pushed to be like, listen, like, I want to do more testing. I want to dig a little bit deeper here before we just move into another embryo transfer. Um, so I think that's kind of the number one takeaway. Um, some of these other questions are a little bit like in the weeds, but I think it's kind of like you don't know what you don't know, especially going into this process. And these are just points that really do vary by clinic. And so once you go through IVF and have frozen embryos, the reason why you might want to know are they stored on site or off site is just to understand like, are these precious embryos going to be here? If not, where are they going to be? And then there's also costs associated with that. And we'll get to that a little bit more with some other questions. But those are just kind of like the surprise things that, you typically don't even know to ask in the beginning. And another thing is PGT-A testing, and we'll get into that as well a little. And Kim, you can help define that for us. But there's, you know, clinics that require it, and then others don't, depending on the patient. So I think those are just all really great questions that are a little bit more detailed that you typically wouldn't know to even ask about necessarily. Um, so let's dive into, kind of getting to the crux of, medications and protocols. I think this is where things start to get a little bit overwhelming for people because for a lot of people, they just like haven't dealt with this amount of medication. They have never had to give themselves a shot. They've done it maybe in a doctor office for vaccines, but it starts to just become like really uncharted territory for a lot. So I wanted you to kind of walk us through what are some of the important questions to ask specifically around protocols and medications?
Absolutely. I always say to once I started working in the fertility space, it made me realize, okay, I went to nursing school, but it feels like everyone needs to go to nursing school because preparing these medications, you feel like you're working all of a sudden in some kind of laboratory, mixing together all these different medications. And I could only imagine as someone who hasn't been trained in medication administration, it could be very overwhelming. And then to give yourself an injection, it's not natural. As a nurse, I've given tens of thousands of injections to patients over the years, but to give yourself an injection is just not what we're used to doing. So my heart always goes out to every single patient with every single injection that they ever have to give themselves, because it's absolutely not easy. And for all of our listeners, I just applaud you for each time you give yourself that injection. It's really like a victory towards your path to parenthood and your path to securing that fertility investment and journey that you're working towards. So really just want to give like kudos to that. Before we get into protocols, I think it's important to I'll do a very brief overview about why we're taking these medications. And so if we're going to be speaking specifically to the IVF aspect of the fertility journey, because there's often a confusion that the fertility journey means you're going straight to IVF. There are multiple different procedures one could do. It could be timed intercourse, it could be ovulation induction. IVF, which is in vitro fertilization. The goal in IVF is for the doctors to provide a protocol for a woman to grow and develop multiple eggs, and create embryos by fertilizing those eggs with sperm in a laboratory to create embryos to implant either days later, which is called a fresh embryo transfer, or one future, which is known as a frozen embryo transfer. It's a whole long process, but that's a very quick summary of it. And in order for a doctor to know what protocol is best for you, they are going to take a look by doing at your diagnostic testing, as we discussed earlier. So women are born with all those eggs they'll ever have. And there's a doctor I actually love. Her name is Dr. Crawford, Natalie Crawford from Texas. She's a very famous fertility doctor. She always uses the example that all of your eggs are in a vault. You're born with all those eggs you'll ever have, and only a set number of eggs come to the surface of your ovaries at the beginning of each month. We can only tap into those eggs. We can't tap into the hundreds of thousands of thousands of other eggs that you have remaining in your ovaries. And each month, typically, if you're not going through a fertility journey, you are going to grow and develop only one out of, let's say, it could be 5 on each side, 10 on each side. The younger you are, the more you'll have. And one will grow and develop and eventually ovulate. But the goal with the fertility journey is that with IVF is that we want to stimulate multiple eggs at once to grow and develop. And we're going to be giving you medications to get multiple of those eggs to grow and develop. Watch that over the course of a period on average 10, 11, 12 days. And then extract those eggs once they're ready, right before they would ovulate, in order to work with them in a lab for future use. But knowing what protocol is best for you could feel very overwhelming, especially when you're talking to other people who are going through their fertility journey as well. I can't tell you how many times I hear of people said, well, I'm taking this amount of this medication. My friend's taking that medication. Well, this protocol works for my friend. Can I try this protocol? Maybe this is better. And it could get really, really confusing. And this is where I always go back to no fertility journey is the same. You could have two people, the exact same age, the exact same fertility diagnosis, but still respond differently to medications. So typically speaking, what a doctor would offer, I'm going to touch upon a couple of protocols, but a very standard protocol is what's called the antagonist protocol. This is in order to get those eggs to grow and develop. And we monitor that over the course of the next 10, 11 days. But you could have what's called the microdose Lupron protocol. These are different protocols that your doctor will decide what's best for you based on either your blood work, your ultrasound, and also in terms of how you responded at your first in your first round. There are some people who respond very well to that initial protocol, and the doctor will say, okay, why fix what's not broken? Let's do this again if we need to get more eggs. But there are some times where a doctor would be like, wow, we did not get as many eggs as we anticipated. You did not respond the way that we had hoped to. Let's try to change things up. And I think it's important to speak with your doctor about if a cycle does not go as planned, advocating to have what's called like a regroup or a touch-based session with your doctor, being like, okay, what can we do differently next time to hope for a better result? Because if it could be very discouraging if your doctor's like, yeah, like it just didn't work out, let's try it again, and they don't change anything. I can understand how frustrating that could be. I've seen that happen before. So I like always I advocate that speak to your doctor, share with them, okay, what can we do differently if this protocol didn't work for me?
Thank you. That's super helpful. Um, I, yeah, I think that I just want to underscore the point that no person's journey is the same. And at the end of the day, it's really trying to get at what's best for you. I think some people feel like they're just put on this like standard protocol, right? And maybe it's not as tailored to them. But what I could say, again, just from my own experience, is really knowing what you want and asking the right questions of like, what is this doing for, like, what is the goal of changing XYZ? Are there alternatives? Like just straight up asking those questions based on what you're looking for. Um, I knew just based on asking my clinic that in terms of going into IVF, there's an option to do a medicated route where you're basically timing everything. So you're taking birth control and you're stopping ovulation and then you're like planning it versus having one that is ovulatory, like letting your body like go naturally through ovulation in your cycle. And my biggest driver was like, as soon as I heard that on this one I had to go on birth control, I was like, no, 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 no. Like, I'm not doing it. And so I just wouldn't have known if I hadn't asked that, like, hey, listen, I just would like to avoid, if there's any way that I can avoid this medication, like what would that be? And that's when they told me that there was this other option. So I actually don't think that they were going to be like forthcoming and saying like, hey, we could do this or we could do this. They were just going to put me on the timed, cycle for my retrieval. And so I just wanted to share that to say that you just never know. And so continue to ask, what is the best protocol for me and why? And then I do think it's really important to ask about side effects of the medications. That's one thing I also wanted to highlight because, again, everyone responds differently, but ask your doctor or the nurse because a lot of the time there will be educational videos. And Kim, I'm sure you've walked many people through how to do injections and everything. But there's also like, what is this doing? Like, why am I taking this? And what are the potential side effects so that if there is something that comes up, you're already prepared and not, stressed about like what's happening. Is this normal?
Absolutely. And I think, oh, sorry.
Go ahead.
No, I just think it's so important. People often, myself included, there have been medications I may have taken in the past where, even as a nurse, like I don't know every medication on the planet, but I try to do my due diligence of knowing what is this and how does it work and what is it doing to my body. It's so easy when you have so many things on your mind in the fertility journey. You're going to be like, okay, I'm blindly going to just trust in what the doctor and the nurse is telling me. And I think to understand what these medications are doing is really important to understand what is happening with your body, especially because sometimes they will have some side effects that it could catch you off guard if you weren't expecting it. So, for example, one of the most popular common medications that are taking in the fertility process is called Gonal-f or Follistim. And this is what's called, in a fancy term, a gonadotropin hormone, which what it does is that it releases more of follicle stimulating hormone from your brain to tell your ovaries to grow and develop those follicles. So a follicle is a fluid filled sac that it's like a little sac. It's very small. You can't see it. It's microscopic. You can only see it on an ultrasound, and the egg inside of it's microscopic. But a fluid filled sac, it's filled with fluid. So as that's growing and developing, you're going to have more fluid building up inside your ovaries. And that's going to cause pressure on your ovaries and your pelvic cavity and your abdomen. It could cause discomfort. It could cause nausea. So it's very common that people could experience increased period like symptoms while they're going through this process because you're taking this medication now for on average 10, 11 days. That could be very uncomfortable. In addition to feeling a bit more fatigued, tired, these period like symptoms that you may have, and your ovaries are enlarging. They're going from being the size of almonds, your ovaries are very small, to the size we could say of nectarines or even grapefruits in some situations, which is not natural at first. And so it's really important to know what these potential side effects are in order for you to take care of yourself once those side effects come into place. Something that I like to discuss with both a nurse and with all of my members here at Grain is let's get ahead of this and not be reactive, but be proactive and discuss what are symptoms that you may experience before you begin treatment, what you should avoid to prevent the exacerbation of those symptoms, and if you get any of those symptoms, how we could treat them properly. And that has truly has helped a lot of people navigate the process in a much simpler way and had a much more positive experience without feeling panicked and rushing to their doctor or another care provider, throughout their fertility journey. They have enough to worry. Everyone has enough to worry about as it is.
Yeah, thank you for that. And the one other thing that I wanted to share is also having an idea of like how much you do want to know. So like, yes, if you're in a state of mind where you're like, I want to know what's happening. I want to know the details. I was not in that state and I was only like able to walk like that, or not walk, like think that day, hours ahead, maybe a day ahead. And so I wasn't in a place where I was even thinking about these questions. And I think that that's why we're having this conversation is just feeling a little bit more prepared and knowing that just even taking this list of questions will hopefully get you a little bit more prepared, to know what's ahead, not going into it blind.
Exactly.
Um, Great. Okay, so we're going to get a little bit in more in depth. Some folks had questions around PGT-A testing. So before we um, get into the like what you should be asking your doctor or nurses about PGT-A, can you just explain to us what it is first?
Absolutely. So PGT-A testing, in short, it stands for pre-genetic testing, and A is for the word aneuploid. So when we want to look at going back to like biology 101, not going to get too much into the details of it, but in order for an embryo, which is going to be half egg, half sperm, in order for it to grow and develop properly into into a pregnancy, both the egg and sperm need to have the correct number of what we call chromosomes. So you're going to have 23 chromosomes from the mother, 20 from the egg, 23 chromosomes from the sperm. And so what the genetic testing is doing is to make sure that we have the appropriate amount of 23 chromosomes from each parent gamete, which is the sperm and an egg, to a total of they cross over to a total of what is 23 pairs, which is 46 chromosomes in total, 23 from the egg, 23 from the sperm, not to get too technical. But what's important to know is that fertility, both for men and for women, declines with age. And what happens is that not only is the quantity of eggs for women going to decline, but the quality of those eggs are going to decline with age. Men are able to actually produce sperm, throughout their entire life, and they're constantly creating new sperm. But as men get older as well, the quality of the sperm will deteriorate with age, and that happens at the cellular level of those gametes of the egg and the sperm. And so, why doctors often may want to offer PGT-A testing for their patients would be and I'll get into how the testing works, is just to ensure that that embryo has the proper number of chromosomes before it would be implanted into the uterus. Now, one of the most common reasons that miscarriages will take place in the first trimester is because of a chromosomal abnormality. When it comes to PGA testing, if it's right for you, if it's not right for you, where it's offered, where it's not offered, it's very important to have that conversation with your fertility doctor. As someone who's been working in the fertility space, I've worked at fertility clinics that absolutely require PGT-A testing in order to proceed moving forward. It's very much encouraged. I've also worked with physicians who don't encourage it. They have studies that show that it may not necessarily improve outcomes. So since I'm not an embryologist or an REI, I can't get into the exact different studies because there are many studies that are out there. But what I would encourage everyone to do who's listening on our call is to have that conversation with, your doctor and with your partner to see if PGT-A testing will be beneficial for you and your fertility journey.
Thanks for that. Yeah, I think it's really important to underscore that the question really should be like, is it right for me? Like, is it just a blanket requirement that have all your patients do? That's one thing versus working with an REI. And I know there are many out there who will recommend it or say, you know what, it actually, based on your age and based on certain factors, we really don't need to do it. So I think the number one thing is to ask and understand what the protocol is for the clinic or doctor that you're working with. Um, and then also, like, why are we doing this? Like, what information are we going to learn from the testing? Most of the time you will be able to understand sex. You'll be able to get a grading for the embryos, like the quality of the embryo. But my understanding is that those grades can also vary by clinic. So I think that that's an important thing too, is like, okay, we're going to do this testing. Like, what are we hoping to learn? And again, I just want to mention that this can be a lot. So if you feel like I'm not ready for that, like let's cross that bridge when we get there, you can kind of have those questions in your back pocket after you do a cycle, and start talking about, like getting ready to prepare for it and then see what the results will be. But I think going into it, it's good to know, like, are you going to require this? Is this part of the process or not? So there's not any surprises afterwards. Um, I will say the clinic I worked with, did not require it, but I talked to friends who didn't even know it was an option with their clinic. They didn't get it done and it was never talked about. So the kind of the moral of the story is here is just ask and understand what is available to you and then also why, if the doctor is recommending it or not.
If I may add also, you spoke perfectly about PGTA, something that is less talked about is what we call PGT-M, which is, but for M is for monogenetic. And I'm not a geneticist. I'm not going to go down the route of talking about genetic counseling. But a lot of people actually turn to IVF because one partner or both partners may be carriers of a genetic disorder that could potentially be passed down to their offspring. And it could be something that's passed down. There could be a 25% chance, 50% chance that it's passed down. And it could be a debilitating disease that may have impacted family members, or it could be just, something that you don't feel comfortable with your offspring having, or that they may be a carrier and it could impact their fertility in the future. And so if you are going through the fertility journey, if you decide to do genetic testing, a lot of fertility clinics may offer it, or they may not even offer it. Like you mentioned, you have to bring it up yourself and be like, sure, we could do genetic testing as an add-on if you'd like. PGTM is a more in-depth process than PGTA, as much as PGTA is also complicated in and of itself. But it's important to find out what your options are, that if you and your partner are both carriers for a genetic disorder, or one of you is a carrier, what are the options if PGTM would be recommended for you both in order to prevent any genes from being passed down in the future. And I think that's often, I know people in the past who they didn't pursue necessarily parenthood, or they didn't know that there was this option of IVF, and it led to, not being able to build the family of their dreams. But if they had only known about these options, it would have made their route to parenthood very different.
Thank you for that. That's super helpful. Okay, I think this is maybe kind of, or there's two more kind of areas to cover. So after a failed transfer or retrieval, um, I think, there's so many hopes and expectations, and when things don't go how we want, it can feel like a huge setback. And so I wanted just to specifically address this, and give people some questions and tools to go back to their clinic with.
It's incredibly heartbreaking and frustrating when, especially after an egg retrieval doesn't go the outcomes that you don't get the outcomes that you want, or a transfer didn't take, or maybe a transfer took, and then after following appointments, I've had very, very difficult conversations with patients of mine with very disappointing news that they've received. And the most important thing to do, in my opinion, at the time is focusing on the right now, focusing on, I don't want to use the word acceptance because that's not the right word. It's just taking care of yourself both emotionally and physically, because it could be you're going through something already so emotionally and physically taxing. To receive disappointing news about a failure, the most important thing to know is you're not a failure. You did nothing wrong. But unfortunately, the procedure may have not gone the way that we had hoped for it to. And so I think this all goes back to taking the time for yourself and then having that open communication and dialogue with your healthcare team about, okay, we're recuperating and we're recovering from where we've been, and how can we proceed moving forward? I think is something really important to be proactive about. What can we do differently? What tests could be done to see what happened? Monica, you had mentioned that you wanted extra testing to be done, and that really helped you with your fertility journey for moving forward. If you could add a little bit more about that.
Yeah, absolutely. So, I, after our second transfer was successful, but then we lost that pregnancy in the second trimester, I was really adamant about additional testing and not just, going into another transfer cycle. So I would say that. I think it's just really important, no matter where you're at, whether it was, the results that you had, wish you had for the retrieval, or a transfer, is just to go back and say, well, why do you think it ended up like this? Were there any sort of indicators leading up to it that would have given us any, I guess, signs that this would be how it would end up? Like, where do we go from here? And I think this is important, is like, what is guiding our decision on what's next? Are you strictly looking at my medical history? Are you thinking about, what other patients that are kind of in my shoes have had success with? Like, give me some, data points that will give me a little bit more comfort of like, we're deciding on a plan together that is based on what I need and what we think will work for me, right? Versus just like going back and going through kind of the same. And maybe the doctor will recommend, like, listen, like, I think we stick to the protocol for XYZ reasons. And I think what we want here is a little bit of peace of mind that we know that we're doing certain things for certain reasons versus, feeling kind of just like dismissed, like, well, we're just going to try again. Like having that conversation, I think is really empowering. Um, and that's why this, are we going to change our approach and why or not? And I think that just can give a lot of comfort, just having that conversation with the nurses that you're working with or the doctor.
I agree.
And then last but not least, just really the support. There's so many, it is so scientific and so medical. Reproductive technologies have come a long way, but we cannot lose sight of, some of the other support that we need other than the scientific, rigor that comes with all of this. And so this last piece is really around emotional and financial support, which I think are not often top of mind for clinics. I wouldn't say always, but I wanted to just chat through these questions to actually ask your medical team, whoever you're working with, to see if they can support in these areas.
I
Um,
agree. Yeah. No, I agree. I think it's super important to find out, like you mentioned, not every fertility clinic may have the services and the resources, but many do, and many are starting to bring that on as an important element for their fertility, like for fertility care. It's not just the physical, it's also the psychosocial component as well.
Great. And I know that sometimes a fertility clinic can refer you to mental health professionals that like specifically work with folks who are going through fertility journeys. Like, I think that's really important. And I know, Kim, you had mentioned that Grain has some relationships with folks that like specialize in this area. So I think I just want to kind of highlight that there are mental health professionals that are more trained, trauma informed, and just really understand what the IVF process is all about, which I think is really helpful. Because then when you're talking about going into a retrieval or after a transfer or loss, um, they just they can be a little bit more empathetic and can give you the support that you need. Um, and then for the cost piece, I wanted to highlight that I actually was able to get a 5% discount on my IVF cycle just because I asked. I was like, I'm a cash patient. Like, what can you do for me? Because this is all out of my pocket. So I think sometimes, again, clinics can be super supportive in terms of guiding you to resources that you need. Sometimes they are not. But I would say step number one would be just always ask and um, ask them also to consider any specific things that are important to you. Like, hey, listen, I have meetings starting at 9. Like, can we prioritize my appointments first thing in the morning? Like, what will help you in this process, in terms of accommodating your schedule, or maybe you've had past experiences that are making this really an emotionally difficult time. And so the more vocal you can be about that, I think doctors and nurses want to meet you where you are. So, bottom line is share as much as you possibly can about what you need to make this process go as smooth as possible from a financial, emotional support perspective. Um, Awesome. I wanted to open it up to Q&A. Um, Tiffany, thank you so much for joining us. A little bit late, just wanted to say hi. Feel free to drop any questions in the chat or go off mute. And I also wanted to give a few minutes to just share about grain fertility a little bit deeper. And Joe Cody, actually, the founder of Grain Fertility, is here with us. So, Joe, I wanted to give you the floor for a few minutes to share whatever you want about your story.
And thanks so much, Monica. I appreciate the chance to get to meet everyone, and more importantly, for having a community like Rhea for people to be able to turn to. So, a little bit about myself. My wife and I went through around 4 years of IVF to have our daughter, and over the course of those 4 years, we had 6 total cycles, 5 of which failed, including one chemical pregnancy. 2 different clinics that we went to, spent over $50,000 out of pocket, and my wife has multiple other conditions that she's managing, including thyroid issues, autoimmune issues. And so we were dealing with a lot of different doctors at the same time, and we were completely overwhelmed by the process. We didn't have a way to stay organized, to utilize all the information at hand to make informed decisions. And then on top of it, we had to use third-party reproduction in order to have our daughter. And so we had legal documents, medical records, financial documents, contracts, everything that someone's managing. And my wife created a 3-ring binder, carried it around to all of her appointments. That was how she stayed organized with everything. And we thought there has to be a better way to do that for patients. So I founded Grain Fertility, and Kim joined me shortly after to provide expert guidance and compassionate support to patients to understand and have the support they need as they go through the treatment process. It's something that I wish I had and we had gone through IVF. The clinic that we were at, although they were well-intentioned, did not provide a lot of resources for us or answers. You did feel like a number at that place. You were going into the waiting room and you see lots of other people there waiting. If you needed to get a question answered, you had to wait 36 hours for, a message on your portal to your nurse, etc. So We really are here to be able to help support anyone who's navigating IVF, fertility treatments, or pregnancy loss. We know that not one journey is the same, and I have really learned a lot from this conversation, and just brings me back to all the things that I experienced going through and some of these early considerations that we're talking about here. I didn't know any of those things, and my wife didn't know any of these things going into it. So, what we hope to be able to do is to use our accumulated experience and knowledge and the community that we've developed to help support those that are going through their journey and make them effective advocates for themselves. I think that's the most important thing that we aim to be able to do is to provide you with the resources, tools, education, and community to be able to help you make the most informed decision possible in an incredibly hard process where there rarely are black and white, yes or no answers, unfortunately. So you have to feel incredibly comfortable with what's happening, and asking these questions is incredibly important. So I appreciate the opportunity to be able to highlight Grain Fertility. And I know we have some resources available to the REA community that we are happy to share. And then also REA community members do have access to Grain Fertility, and we're providing discounts to any members who want to join because we do think that it's incredibly important that people have access to resources as they go through this process. So I'll turn it back to you guys to answer any questions that Tiffany or others who have joined us may have. And if anyone wants to be able to learn more about grain fertility, they can go to our website at www.grainfertility.com. Reach out to me on the REA community. I'm involved in it. I'm more than happy to answer questions. If you want to be able to connect with Kim or I, we're here for you. So thank you so much.
Thanks, Jody. Jody, I just put your, do people do that all the time?
I've been getting that my entire life, so it doesn't even
Mm.
faze me
It just rolls off the
anymore.
tongue.
It does.
Thanks so much, Joe. I wish grain was around when, or discovered grain when I was in the thick of it, just scrambling, trying to navigate my way. So thank you for building this from lived experience. I did want to again highlight the special offer. It's a 20% off of membership and personalized support. Um, there are different tiers, right, for grain fertility. So some folks might want to just use the platform for organization, versus some folks might want to go a little bit deeper and get that one-on-one personal coaching, depending on, what they're looking for. We'll have this information